Good afternoon, everyone. I hope you are enjoying this absolutely gorgeous day, and maybe that you're even outside watching this on your phone or something. But if you're not outside, get out there as soon as you can and enjoy the beautiful weather while we have it. And I hope everyone is well and healthy. We'll keep it brief today. At the high level, we are really making progress here. The numbers look good in basically every dimension. So that is great news. And to me, the key takeaway from that is that the vaccine works, that the numbers going down are not by accident. It's because we're getting our vaccination numbers up. People are continuing to be careful, but we are able to reduce and remove a lot of the restrictions. And all of that coming together has us in a place where essentially the numbers are near as good as they've been throughout the entire period. We'll talk about some of the different metrics diving in here now. So by the numbers, total cumulative cases now 15,144. We're approaching 386,000 tests completed, 14,000 plus recovered. We are, though, still continuing to see that this is a dangerous and still deadly virus. We've had 3 additional fatalities in the last week since our last update. A very continued sad reminder that we have to take COVID seriously and that we all need to get to that herd immunity point so we don't have members of our community hospitalized and very sick and dying. Our hospitalization numbers are going down, which is very good news. We're at 5 currently hospitalized in Ulster County beds with COVID. 2 of them, though, are on ventilators in the ICU. So we do still see a significant number of percentage of people that have cases getting sick enough that they need to go to the hospital. Again, all the more reminder for why we need to get everybody vaccinated and push through this. Active cases. When I saw the numbers, I almost had to do a double take. We're at the lowest numbers of active cases since the beginning of the pandemic. We currently have 68 active COVID cases in the entire county. As you'll, I'm sure, remember at certain points of this, that was the number of cases in some of our smaller and medium-sized towns, and we have 24 municipalities in the county. So really good to see those numbers come down, and of course you can see it very starkly on the graph. That's all driven by the new positivity rate, which we continue to very carefully monitor and track. In the last 48 hours, we've had some of the lowest numbers of new positive cases ever. 2 days ago, we actually had only 1 new positive case out of 857 tested. Last 24-hour period, we had 5 new positive cases out of over 1,000 tested. So our 48-hour new positivity rate is at 0.32%, 0.32%, and our 7-day sort of rolling average is at 1.1% for new positive rate. So that is great. We want to continue to do the things we're doing to bring it down, but to be clear, the main and overwhelming driver of bringing our numbers down is vaccinations. And of course, we now know with the CDC guidance being passed down in terms of masks and other precautions, that as soon as you're vaccinated, the world is a little bit of a more open place, and feels good to see that all coming to fruition here. Hospital capacity, not concerned at this point. You can see the current numbers, and we have more than sufficient capacity for any future needs. The numbers that we're most focused on now, of course, are vaccination progress numbers, so I'll put those up on the screen now. We are continuing to make progress here, but it is slowing, and we need to speed this up. The faster that we get to herd immunity, the faster we can all move forward, and the lower the chances are of a variant emerging. And I think that is really important for folks to understand and to share with others, that this is a race, and that if we don't get to herd immunity fast enough, the odds of a variant that could be resistant to the vaccine emerging go up each day that we don't get to that herd immunity point. The good news is Ulster County is still doing really well here, especially as compared to our peers in the region and in the state. We're now at nearly 69% of adults 18 and up with their first dose, and nearly 60% of our full population with their first dose. But that still leaves thousands of folks that need to be vaccinated, and we're going to continue to do that work and make it as easy as we possibly can. You can visually see here on this next chart the number of opportunities will continue in terms of opportunities to be vaccinated. There's 8 different upcoming vaccine clinics. All of them are walk-in clinics. Most of them allow an individual to choose which of the 3 or 2 vaccine options they want. Some of these clinics are primarily for second doses. For example, the one at Gardner Town Hall today is primarily for second doses, but we'll also open it up to any walk-in folks who haven't had a chance yet to be vaccinated and need to get a first dose. So I'll just leave this up, and you can see the different upcoming sites all throughout the county, including 2 options today, even up till 8 p.m. at the Best Buy site at the Hudson Valley Mall, and finishing up at the Gardner Town Hall today and all through next week across the county. I do want to continue to thank our volunteers and our staff that are running these clinics. It's a serious logistical operation. They're continuing to do that work, showing up really early to set up, delivering vaccines all day, and then going home at the end of the night and doing it again. And this team has really been doing that now for quite some time, so thank you. The other thing that we're doing is to make it as easy and predictable as possible for folks. We're having a recurring every single week walk-in clinic every Thursday afternoon into the evening from 3 to 8 p.m. at our Hudson Valley Mall site at the former Best Buy location. That will continue, particularly set up for folks that may work the sort of 9 to 5 hours so that they can catch an after-work period, or if they have other logistical challenges with childcare or transportation. We are still on the front of transportation offering free rides for anyone being vaccinated on our entire UCAT bus system, and door-to-door service for anyone that might need it who are seniors or those with disabilities. So you can reach out to us for that. The other kind of fun and interesting thing we're doing in partnership with Stewart's, we've talked about this already, but as a reminder, yesterday we had our first walk-in clinics at Stewart's. That was the one in Milton, and I want to thank the team there and the leadership at Stewart's as well. And then next week we'll have 2 different Stewart's vaccine clinics, one in Ellenville, one in Rosendale. And as an incentive, the first 100 folks at each of those clinics will receive a coupon for ice cream or coffee, and everybody knows how good Stewart's ice cream is. So for me, that's not a hard choice, but everybody can pick what they want. All this information and more about the vaccination process is on our website at vaccinateulster.com. That continues to be the one-stop shop for all the information, including frequently asked questions, health-related questions, and logistical questions as well. That is really our COVID update. I wanted to very quickly hit 2 other updates, one of which is they're both important, but one is a major positive development for the community. As we come out of the pandemic, we saw and have talked for the last year about the impacts on those struggling with mental health issues and addiction issues. We saw our suicides in Ulster County in 2020 nearly double, our fatal overdoses nearly double, and so we've been doing a lot of work and making a lot of investment to meet the growing need for mental health and substance use services in the county. So this morning I had a really exciting moment to open up what will be a new mental health and substance use urgent care. So think the normal urgent care that you go to for all other health issues. We now have a mental health and substance use urgent care in Midtown Kingston. That will open next week on June 1st in partnership with one of our great partners, Access Supports for Living. I want to thank them. They're the organization that already runs our mobile mental health, and this is really an expansion of that. So it's in the location will be right next to the Health Alliance Hospital on Broadway in the Medical Arts Building, right next to the hospital and just across the street from Kingston High School. The The clinic will be open Monday through Friday from 10 a.m. to 6 p.m., but there will also be 24/7 support available via our mental health hotline, where at any moment an individual or a family member or loved one or just a community member can call and ultimately direct someone to this walk-in clinic where everyone will be accepted and no questions asked. In addition, as part of this new partnership with Access Supports for Living, we're also plugging into this a mobile care provider specifically focused on substance use. So if you are struggling with addiction or a family member and you need someone to help come to you, you can also reach out to that same hotline and we can dispatch a trained professional to work with you or with your loved one and get you the care that you need. So this is part of our plan, although there will be much more work to do and many more investments to come. But this initiative that we announced today is one of the very first recommendations that came out of our behavioral health task force. So just a few weeks ago, we stood up a county-wide group of experts and leaders, as well as family members and individuals who have struggled with mental health and addiction issues. We've been brainstorming how to meet the needs and address any gaps in our system, and this was one of the clear needs was just a place where people can come in person, especially with the unfortunate removal of some of our inpatient services, which we're continuing to fight on with Health Alliance. But this helps address some of that, and of course we have more work to do, but this is an important part of that. So again, thank you to Access Supports for Living. Much of this is funded through our Healing Communities program and grant, which is federally funded. Dr. Tim Hunt was there and runs that program. Also thank Tara McDonald, who leads our mental health team, and Kingston School Board President Jim Shaughnessy was there as well, who does a tremendous amount of work on mental health issues. But also we had great conversation about really making sure we can offer up our mental health services for our young people and our students for whom this is a growing problem and a growing need. So I'm really excited, and this is a positive step for our entire community. The other announcement that I wanted to share is a more somber one, but this evening, but an important one. This evening at 8 p.m. at our county office building here in Uptown Kingston, we'll be holding our annual candlelight ceremony to really kick off the Memorial Day weekend. Of course, Monday is the official Memorial Day holiday, but this is a really great opportunity coming into the weekend on a beautiful evening to just take a few minutes and really get yourself in the right frame of mind to ultimately honor and remember those that have made the ultimate sacrifice for our country and for our community. In Ulster County, we have over 1,300 Ulster County residents that are named and honored on our memorial right in front of the county office building, so that's where it will be located. Tonight at 8 p.m., we'll read the roll of honor. We have a great guest speaker who is, I'm very excited to hear from, the commander of the New York Air National Guard, a two-star general. General LaBarge is joining us. Congressman Delgado is going to join us. Many of our veteran community leaders and community groups are joining us. So please, this is open to everyone, though. I think it's really important, and I encourage everyone out there, please spread the word about this tonight at 8 p.m. It's an opportunity for everyone. Bring your kids as well to really help give a sense of the importance and the gravity of this. It is a holiday, but it's a moment to really, in my mind, wrestle with the very real and very human costs of our decisions to go to war. And it's important that every single American, every single resident of our county keep that in mind, particularly as we are still in the longest war in our country's history in Afghanistan, where some of my friends are on their 10th or 11th or 12th deployment away from their families over the last 20 years. So please, again, spread the word on our Memorial Day ceremony. I'll end on that note. I'll thank, as always, all of our frontline workers, including many of our veterans who with multiple different hats on, have stepped up to serve the community and keep us all safe and healthy. Thank Radio Kingston and Diane and Manuel and our whole team who brings this broadcast to you and has been bringing it to you. We'll let everyone get back outside, enjoy this beautiful weather. We'll hopefully see you tonight at 8 p.m. And thank you again for tuning in and all that each of you have done to help get our community through this last 14, 15 months. We'll see you on our next update Thursday, a week from today at 3 p.m. And let's keep the positive progress going. Please get vaccinated if you haven't already.